Hello everyone, welcome back to another video. So in this video we're going to continue discussing about drugs acting on uterus, right? So in the previous video we discussed about the basic general introduction regarding what are the drugs that we need to study, and then we discussed in details about oxytocin, right? Oxytocin. So we finished details about oxytocin. So if you have not watched that video, I would highly recommend you guys to watch that video, because a lot of the things that we are going to discuss in today's topic, which is prostaglandins, the things that I mentioned in the previous video, those are important, and then come back to this video. But before I go into today's topic, that is prostaglandins. Hello guys, so I am Prayas and I am a student in Chittagong Medical College, and I kind of like studying, enjoy studying, not that much, but I kind of like studying, and fortunately I have been fortunate enough to get honors in a couple of subjects during my prof, right? And you know what I love more than studying? I love teaching more than studying. I really freaking love teaching, right? So I do online lectures, right? Online lectures. I also teach offline classes as well. So if you like the way that I teach, and if you like the way I explain things, and you need guidance on a particular topic, then you can always contact me, and you can get the link to contact me on my website. This is my Telegram link, and the link to my website, you can find all the information how to contact me if you need professional guidance. You can go to my website, the link of which I will leave in the first comment section of this video. So do make sure to check out my website. Also, apart from teaching medical students, I'm teaching currently a couple of third and fourth year students. So apart from teaching students, I also enjoy making medical notes, right? The notes that I use for my own prof and term exam preparations, right? So I have notes covering everything from viva to written of all these subjects. I have notes on community medicine, forensic medicine, pathology, pharmacology, and microbiology, basically covering all the questions and answers of viva, the most common questions and answers of written exams as well, and in a way that is easy to understand, that is focused only exam questions, so it will hopefully save you some time. Do make sure to check my website out, and you can buy these notes from my link here, that is from my website, which again the link of which is present in the comment section of this video. So with that out of the way, let us discuss today's topic, that is drugs acting on uterus. So today's topic is prostaglandin. All right, so prostaglandin is also a type of uterine stimulant drug, right? So it stimulates, or it's also known as ecbolic drugs. So in the last video we discussed ecbolic drugs are those drugs that contract or stimulate the uterus, right? So what is prostaglandin? Prostaglandin is a type of autocoids, right? Autocoids, right? So similar to oxytocin was neuropeptide, right? But prostaglandin is an autocoid. Now you might be thinking, what is an autocoid, right? Autocoid, same thing probably. So autocoids are those chemicals that are secreted in the body that are highly reactive, and then they work on the nearby tissues that they are secreted from, right? So other examples of autocoids are leukotrienes, histamine, right? Have you heard of these names? Leukotrienes, histamines, right? So serotonin. So all of these things, they influence. These are chemicals that are secreted in the body that affect the nearby tissues, like they affect tissues within the body. So these group of chemicals are known as autocoids. Auta means self, right? So they affect the cells that from which they are secreted from as well. So for example, if there was this cell and it secreted this chemical autocoid, for example prostaglandin, this prostaglandin will affect this cell from which it came from, as well as it will affect the nearby cells as well. So that's why it's called autocoid. Auta means self, right? So prostaglandin is a type of autocoid, right? So with that out of the way, let us discuss the important stuff, right? So we know prostaglandin is autocoid. What type of contraction does prostaglandin do? So the type of contraction that prostaglandin does is a clonic type of contraction. Now if you don't know what clonic and tonic type of contraction is, I've discussed these topics in detail in the oxytocin topic, so you can find that video in my channel, right? So prostaglandin and oxytocin, both of them cause a clonic type of contraction, that is contraction followed by relaxation, right? It is the same as oxytocin. So where is prostaglandin used? So the main use for prostaglandin is to cause therapeutic abortion, right? Therapeutic abortion. So it is used to cause abortion. This is the main use of prostaglandin. Now how does prostaglandin cause abortion, right? So before I get into how does it work, let us first think of a clinical case, right? For example, what is therapeutic abortion? And you might have studied in forensic medicine. Therapeutic abortion is a kind of abortion. Abortion means abortion, right? Expulsion of the fetus, right? If a woman is pregnant and you want to terminate the pregnancy, that is known as abortion, right? So why do we do therapeutic abortion? Therapeutic abortion, we do it to save the life of the mother, right? Or due to other causes. For example, if a woman came to you and she was a rape victim, right? She was a rape victim, then and she got pregnant because of the rape, right? She got pregnant because of the rape, right? Now if you allow this woman to go on with the pregnancy, then she'll give birth to this child, and then this child, she does not want this child, right? And then because of this child, she will face a lot of social stigma, and then the life of the child would also be really hard, right? Because it's an unwanted child. So in this case, and in many cases, like if a woman who's not a rape victim, but if the woman has a certain medical condition in which continuing the pregnancy might be life threatening to the woman. So if a woman goes on with the pregnancy, then because in the delivery process process, there is a high likelihood that the woman might die due to the delivery. So in both of these cases, right, in this case, whether to save the life of the mother or whether to, in cases of rape victims, right, where the victim will suffer a lot of psychological and social trauma if we let the rape victim give birth to this illegitimate, unwanted child, right. So in this case, we do therapeutic abortion, right. So I just thought it was important to mention why we do therapeutic abortion. So if a patient, if a woman comes to you and then she's a rape victim, let's say, and then you do the ultrasound and you see that there's a baby inside the uterus, right, and now your job as a doctor is to therapeutically abort this, safely do abortion of this baby, right. So say for example, the woman has a baby inside the uterus, right. So in order to expel, abortion means what? Expel this baby outside the uterus. What do we need to do? If we somehow manage to contract this uterus, right, if you somehow manage to strongly contract this uterus by giving chemicals, what chemical will we give? We will give, you guessed it right now we will give prostaglandin, right. So if you give prostaglandin, hold on, you can't see this, so we will give prostaglandin, right. So if you give prostaglandin, what will prostaglandin do? As I mentioned earlier, prostaglandin does clonic type of contraction. This is prostaglandin. If you give, it will cause clonic type of contraction of the uterus. When it does clonic type of contraction, the uterus will contract and relax, so that this baby will be pushed out or expelled from the uterus, so that you have successfully done abortion. This is known as abortion. So when you give prostaglandins, it will contract and relax the uterus, forcefully pushing the baby outside, and we do it to save the life of the mother, or in case of rape victims, to expel or to do therapeutic abortion. I hope that makes sense. Now one question you might be asking is, since oxytocin, see here, right, let me remove this. I'm going to remove this. So since oxytocin, see here, since oxytocin also causes clonic type of contraction, and I mentioned prostaglandin also causes clonic type of contraction, right. So why don't we give oxytocin to cause abortion, right? Because both of them cause clonic type of contraction. So they should, both of them should be able to cause abortion, right? Because oxytocin will also cause clonic contraction and will probably push this baby out, right? But in the uses of oxytocin, we have not mentioned abortion. Now there's a reason for it, because you probably want to, if therapeutic abortion is usually done in the early stages of pregnancy, right? Because once like if a rape victim comes, and then the moment you see that the victim is pregnant, it is usually in the early, like in the first trimester, in the first 3 months of pregnancy, you will probably diagnose that the lady is pregnant. At that time we do abortions, right? Most of them, or rarely in the second trimester as well, right? So abortion usually happens in early pregnancy, right? But if you remember from the oxytocin video, oxytocin receptors are sensitive only in the later stages of pregnancy, right? But we do abortion when? We do abortion in the early stages of pregnancy, right? So even if you give oxytocin, if you want to do abortion, and instead of prostaglandin you give oxytocin, will this oxytocin work? No, it will not work as well as prostaglandin. Why? Because we've studied that oxytocin receptors are more on the uterus only in the last stages of pregnancy, right? In the last stages of pregnancy, the oxytocin receptors increase, but we usually do therapeutic abortion in early pregnancy. So in early pregnancy, even if when you give oxytocin, the oxytocin won't have enough receptors to do the contraction. That is why oxytocin is not the drug of choice for causing abortion. Instead, prostaglandin. Why prostaglandin? Because prostaglandin receptors are present from the beginning of the pregnancy. You can find prostaglandin receptors in the first trimester, second trimester, third trimester. So if you want to do abortion, prostaglandin is the drug of choice, because the prostaglandin receptors are enough from the beginning of the pregnancy. But oxytocin receptors are only present in large amounts only at the end of the pregnancy, and we do abortions in early pregnancy, not in late pregnancy. I hope that makes sense. That's actually something that you should understand, right? So what is the use for prostaglandin? We discussed prostaglandin is used to cause therapeutic abortion, right? Because the receptors, as I mentioned, are sensitive from the beginning of the pregnancy, right? I hope that made sense. These are the questions that they ask in Viva, like conceptual question, whether you understand it or not, right? Now it is also used in induction of labor, right? Because why is it used in induction of labor? Because both of them, see, oxytocin, if you remember from the oxytocin video, oxytocin is used for induction of labor, and prostaglandin can also be used for induction of labor, because both of them cause the same type of contraction. But here in induction of labor, oxytocin is preferred more than prostaglandin. Why? Because when do we do induction of labor? Labor or normal delivery happens at the end of the pregnancy process, right? After 40 weeks or after 9 months, right? And after around 9 months, at the later stages of pregnancy, again coming back to the same point, which receptors will be more? We know that oxytocin receptors are more in the later stages of pregnancy. So we do induction of labor at later stages of pregnancy, and which receptor is more in later stages of pregnancy? Oxytocin. So even though prostaglandin can be used for induction of labor, which is the drug of choice for induction of labor? Oxytocin is the drug of choice for induction of labor. Why? Because at the end stages of pregnancy, the oxytocin receptors are more than prostaglandin receptors. I hope that made sense, because it's a very important concept to understand, right? So what are the two uses? The main use of prostaglandin is, as I mentioned, abortion. And apart from abortion, in some cases it can also be used for induction of labor. Usually if the oxytocin is not working, or if you don't have oxytocin, in that case you can use prostaglandin as well to induce the labor, because they do the same kind of contraction, right? Now let me clear this up. Hold on, okay, it doesn't go as bigger than this. All right, so let's make it prettier. So now that we did with the type of contraction, we finished the use, we know that prostaglandin is autocoid, right? So now let's look at other important information that you need to know for prostaglandins, right? Prostaglandins are usually given per vaginally, not IV, right? So if you want to give prostaglandin, you are not giving prostaglandin via the veins. You directly give prostaglandins via the vagina, right? Hold on. So you directly prostaglandin via the vagina. So how do you administer prostaglandin? You administer it via the vagina. That's one thing. Other thing is, which I've already mentioned to you guys, right? It is sensitive from the beginning of the pregnancy. That's why it can be used in abortion, and that is why oxytocin can't be used in abortion. And it is a autocoid, right? Autocoid. That is, these are chemicals that affect the same cells that they are secreted from, as well as they affect the neighboring cells. So autocoids are a group of these chemicals, such as prostaglandin, leukotriene, lipoxins, serotonin, histamine. These all are known as autocoids. So prostaglandin is a type of autocoid. So that is it for today's video regarding prostaglandin. I hope it made sense. So in the next video, we will discuss about ergometrin, which is another important, very important ecbolic drugs that comes frequently in your exam. So I hope today's video was helpful, and we'll catch you guys in the next video. Right.